Let's focus now on Raynaud's phenomenon. Now, in Raynaud's phenomenon, you have vasospasms of small arteries, typically in the hands, more specifically in the fingertips and toes. Other areas that can be affected are, for example, the ears and nose. Now again, you have vasospasms of small arteries. Now this is typically in response to cold temperatures. Now cold temperatures again are going to cause vasospasms in the arteries, the small arteries of the fingers and toes. Now this typically affects women more than it does men. The exact cause is unknown. Now let's focus on the clinical manifestations that you need to remember for the Nclex exam. Let's just do this really quick, very brief. Number one, color changes in the fingers, toes, ears, or nose. Now what you will notice first is a white or bluish discoloration. This change in color, this white or bluish discoloration, is due to that decreased blood supply. I talked about how vasospasms will occur. Vasospasms along with vasoconstriction. So let's think this through. If vasoconstriction occurs, it's going to decrease the amount of blood supply to that area. So that decrease in blood supply is going to lead to this white and bluish discoloration. Now, the vasospasm will eventually stop and blood flow to that area will return. When blood flow returns, that area will then appear red. Okay, so the first thing that you will notice is, again, a change in color in either fingers, toes, ears, or nose. Number two, patient will typically complain of feeling cold or numbness. Again, this is due to vasoconstriction, decreased blood flow to that area. When blood returns, patients typically will complain of throbbing, pain, or tingling, again to the fingers or toes. Now, this is due to blood returning to that area. Number four, these symptoms will be increased with exposure to cold, stress, tobacco use, caffeine ingestion, caffeine products. Again, the tobacco and caffeine are going to cause vasoconstriction. Number four, if this happens over and over and over, you can remember that when there is vasoconstriction, vasospasms, again, it's going to decrease the blood supply. If this happens over and over, then the potential for the fingertips to actually begin to die for that tissue. Number five, Gambrinus ulcers. How does this develop? Well, again, if we have a decreased blood supply to, for example, the fingertips, that decrease in blood supply may lead to tissue death, to necrosis. That's how this occurs, because again, you have a decreased blood supply to that area. Number six, brittle nails. Number seven, decreased cap refill. So again, when you're doing your assessments, if you see these changes in color in the fingers or toes, again, you also want to assess the cap refill time. Interventions. What will you do? What will you tell your patient? Number one, you will inform your patient to wear loose, warm clothing. Again, we talked about how this may be caused by responses to cold temperatures. Therefore, you want to keep your patient warm at all times. So again, you will tell them to wear warm clothing. Again, you want to prevent cold exposure. Number two, anytime they have the likelihood, potential to handle anything cold, any ice, any snow, any cold weather, again, you want to tell them to wear gloves. Keep those hands warm. You want to prevent this from occurring. Number three, always use warm water when bathing, when washing dishes, doing anything. Again, always use warm water. Number four, you want to tell your patient to avoid tobacco use, to avoid using any caffeine products. Number five, what may also be done is something like drug therapy, use of calcium channel blockers. So cardizem may be prescribed. Again, we were worried about vasoconstriction, vasospasms. Well, what cardizem does, it relaxes arterioles. If you prevent vasoconstriction from occurring, again, you prevent these symptoms from occurring.